providing resources and comfort to caregivers. This is Caregiver Crossing.
Good morning, good afternoon, and good evening. Welcome to Caregiver Crossing. Thank you so much for being here. If this is your first time joining us, Caregiver Crossing is a show brought to you by Joyce House, presented in partnership with Cardon and Associates. I'm your producer, Noah Taylor. Tina and Terry will both be joining us in the next segment, but for now, you got me. Today on Caregiver Crossing, we're joined by the amazing Abby Vincent, Care Services Director and Death Doula. Abby is an expert in end-of-life care, navigating some of life's toughest moments. She's passionate, knowledgeable, and truly dedicated to making a difference. Abby, thank you so much for being here today.
Thanks so much for having me, Noah.
Absolutely. We're so excited to get into these questions, so I think we're just going to go right into it. So I think a lot of people have heard of a doula towards the beginning of your life, but could you explain to us what a death doula is?
Sure. Death doula, also sometimes referred to as end-of-life doula, death midwife. There's some different terminology that used, but essentially it all means the same thing. So a death doula is somebody who walks with a person through the death and dying process and helps to provide the non-medical emotional support that a person needs during that journey. There's an organization called the National End-of-Life Doula Alliance, and they define a death doula as someone who provides non-medical, holistic support and comfort to people preparing for or experiencing end of life by offering education and guidance. And so it's really somebody to be present with a person and meet that person where they are and help them cope with all the changes that end of life brings.
Wow, I really love that meaning, and then that was very well put. I really like that word holistic because a lot of different people have a lot of different needs, so it seems like this is kind of a thing that's tailored to the individual.
Absolutely, and when we start working with somebody initially, that initial assessment is something we do, and we'll talk a lot about the different aspects of a person's life and what matters the most to them at this point. Mm-hmm. And so we do some work to really delve into what kind of work they would like to do.
So what are some of those things? What does a death doula do in the final days of somebody's life? How is it different from hospice care?
Sure. So it differs a little bit. You know, the classic answer sometimes, Noah, is it depends.
Mm-hmm.
So
it always depends.
It always depends. If we start working with a person who is just interested in preparing and they have quite a bit of time left, presumably, and they're not on hospice yet, and they might want to do some kind of legacy planning, or they might want some work on making sure all their advanced directives are in place. And so there are some things that we can do to help them be proactive about some of those hard conversations and some of the things that the paperwork type things that are really important to get done.
Oh yeah.
So that way, when you prepare ahead of time, when somebody does reach the end of their life, it's not a crisis moment. You have had those discussions with your family. You have all your paperwork in order. Your family knows where to find your life insurance. That's all been discussed and reviewed and written down. And sometimes people just need help making sure all those things are done. And also having some people need just support and guidance and having conversations with their families about some of these more difficult topics.
Go ahead.
Yeah, sorry. I wanted to address the second part of your question too, just about hospice care. So death doulas can work in conjunction with hospice care.
Okay.
And we're seeing more and more across the country where hospice organizations are hiring death doulas. And it's really important for a death doula to coordinate with whoever is a part of that person's care team. You know, hospice treats the medical side. The death doula is working with the person on the emotional side. Mm-hmm. And so we will absolutely kind of be an extra arm for that person and extra support alongside the hospice team.
Wow, that sounds really, really incredible. And I know there's probably a lot of people out there who wish they had something like this, maybe when they went through their loved one passing away and have been through those types of crises before. And,
right.
And obviously this is something like you really want to have help with when you're going through these really, really tough moments. Mm-hmm. So if somebody would want to get in contact with you, to learn more about the end-of-life program at
Mhm.
Joyce House, how would they get in contact with you?
Yeah, you can go to the Joyce House website. You can call us here at the at Joyce House, or you can send me an email, Abby ABBY at joycehouse.org.
Awesome. Thank you
Mhm.
so much, Abby. I know now you have some absolutely wonderful tips prepared for us for dealing with grief during the holidays.
Mhm.
A lot of people have their loved ones maybe pass during that time, or they're thinking a lot about their loved ones during that
Mhm.
time when they're with their family. So if you want to get right into that, I know
Yeah.
you have some of those tips prepared for us.
Yeah, let's jump in. So, the first one that we wanted to mention is acknowledge your grief and your feelings of sadness. You know, we can get really busy during the holidays, especially, right? Keeping ourselves distracted,
Mhm.
being tasky with different things. And this is okay sometimes because we need to do these things. We need to keep busy sometimes.
Very true.
And also, it's important to give yourself some time and space to acknowledge your loss.
Oh, I think that's so important because a
Mhm.
lot of the times we don't give ourselves that space to
Right.
acknowledge it.
Yeah.
Yeah.
Yep.
This next one is to have a close friend you can talk to when you're struggling, which is very, very important. Reach out to them before the holidays and have a very direct conversation. Something like, I know this holiday season is going to be hard without my mom. Can you be the person I call when I just need somebody to listen? Get their buy-in and support, and then call them when you really, really need that person. I'm sure a lot of us have somebody who would be willing to be there for them like that.
Yep, absolutely. The next one is to talk about your loved one and share memories. You know, this sometimes we're afraid to bring somebody up because we don't want to make other people sad, or we don't yet. When you're in a group of people or your family or your friends and they loved that person too, or they know how much you loved them, it can be really wonderful. Uh, and just kind of share those connections with somebody to laugh and cry and share stories. It can be really, really powerful.
I think that's so important
Mhm.
during the holidays too.
Yep.
I mean, you're already with your family. Why not?
Yeah.
Why not have that experience
Right.
and that shared
Yep.
experience?
Yep.
So the last one Abby has here for us is make choices about your commitments and have a way out. There might be some things you literally just cannot do this holiday season. Think this through and consider the need to eliminate some commitments that might not be worth your time. Focus on events that bring you joy. Focus on events that bring you peace and connection. We do have a really, really special event coming up called Death Over Drafts. This is going to be an incredible event for casual conversation designed to spark meaningful conversations around the topic of death and dying. We'll give a little shout out about where that is. It's at the Rook Pub, 2450 East 71st Street in Indianapolis. Now that's going to be on November 13th from 5:30 to 7:30. You can find past episodes of the show at caregivercrossingradio.org and be sure to like and follow us on Facebook. If you'd like to connect with us to discuss show topics, need help connecting with resources, have a question that you'd like for us to answer on air, or just want to say hey, you can reach us at 317-254-0828. Or you can email Tina at tina@joycehouse.org. All right, stick with us. We'll be right back with more Caregiver Crossing shortly.
Let your imagination soar with Audible. With stories across every genre, from expert advice to fantasy, you'll be inspired to imagine new worlds, possibilities, and ways of thinking. Listening can even lead to a positive change in your mood, habits, and overall well-being. As an Audible member, you'll get to choose one title a month to keep from their entire catalog, including bestsellers and new releases. Allow yourself to delve into the spooky this season by listening to classics like Stephen King's The Shining and Pet Sematary. There's more to imagine when you listen. New members can try Audible free for 30 days. Visit audible.com/imagine or text imagine to 500-500. That's audible.com/imagine or text imagine to 500-500.
Credit Karma is your evolved financial assistant, making managing your finances simpler and more tailored to you. Join us at creditkarma.com to start your personalized financial journey today and continue to grow with our innovations. Credit Karma. Evolve your finances.
Welcome back to Caregiver Crossing. We are your hosts, Tina McIntosh and Noah Taylor. Thanks for sticking around with us. And today on the show, we have someone who I don't know that I could have any more respect for her than I do. And I mean that as a compliment, even though that might have come out kind of weird. But Dr. Nicole Fowler is with us. So I'm going to pause, say hello to you, and then I'm going to give your credentials. Hi.
Hi, everybody. Thank you so much for having me. This is an encore for me. This is my second time on Caregiver Crossing.
Well, and really, we could probably have you on every, month and keep you all day long. So you are, make sure I get this right, Director of Research at the Division of General Internal Medicine and Geriatrics at Indiana University School of Medicine and an Associate Professor of Medicine.
That's correct.
What does that mean?
Well, that means that I do my research at IU School of Medicine, and I help other people in internal medicine and geriatrics do their research too.
Oh, that was really nice and easy. Like that, I got that.
Okay.
And your research area, and we've known each other for years, and really I'm like waiting for the thing, right, that we're going to do together, and it's going to be incredible and change lives. And so you really have a heart for family caregivers.
Yeah, I think that my work from the very beginning has always thought about older adults as being part of a family that cares about their well-being. And so it's really hard sometimes to think about how to improve the life of older adults without thinking about the family around them.
I mean, I would almost say impossible, right? There's so much to the family caregivers. And so one of the questions we get all of the time, and I'm having in my own life with someone that I love right now, is how can caregivers differentiate between normal age-related forgetfulness, so just normal aging stuff, and concerns about dementia?
Okay. I also get this a lot. And we get it in the clinic, we get it at home. I think one of the things in particular is we think about, our body is evolving and aging every single day. Our brain is part of that. And so just as our heart ages, our brain ages. So it is true that there are changes that occur over time for two people's brain as they age. I think one of the things that we try to differentiate the most about is it interfering with their daily living? Is it changing their ability to do something that they either were able to do pretty easily a week or two ago or a month or so ago? And is it also out of ordinary for them? So I think that sometimes we'll say, they've never been good at directions. Okay. But you know what? They used to be really good at, doing all the finances. And now this just is not something they're able to do. I'm noticing that there's bills that aren't being paid or, things that are being turned off because of not being able to pay attention to the bills. So I think that's oftentimes what we sort of help differentiate. And the testing that we do actually does try to take into account too what we might consider standard and normal changes for people as they age on things like memory and executive functioning compared to what might be outside of the normal range. So oftentimes when people come and we do some testing, we are able to adjust for what we think would be a normal aging process versus abnormal aging process.
And that's hard. I mean, that's hard, right? It's hard to diagnose that with your parent or your loved one at home too. I have caught myself before saying to somebody who says, like, I came in the room, I came in the room. I can't remember why I came in the room. And I've caught myself saying, if you didn't know that you came in the room and forgot why you came in the room, then that's next level. Like, you forgot why you came in the room.
Yeah. I think sometimes people say, I forgot where I put my keys. Well, that's okay. I mean, we forget where we put all kinds of things. But if you forget what your keys are for,
right,
that's when we need to be a little bit concerned. And I think, too, that's why I really do encourage, I think, because I get this question so often, especially, from family members, adult children, it's really important, too, to get a baseline. I think that, we get a lot of different types of preventive or, baseline lab work about our cholesterol and our blood pressure. And it's really great to get a baseline on how your brain is, especially if you're older and, maybe getting an annual checkup is really important.
It makes me want to go do it now. I have that brain tumor in there. Do you know that? I've got that meningioma in there. And I'm like, maybe it's time for a baseline for me, just to be smart down the road. But I think when you say that, you really are talking an aging adult. I'm 52, but
correct.
Typically someone who's aging or seems to be showing signs maybe.
That's right.
What are some of those common early warning signs of dementia that people can be looking out for?
Mm-hmm. Well, I think some of the things that we would maybe look out for in the earliest stages is, changes in behavior, such as sort of appearing to be more apathetic, maybe not necessarily paying attention to the conversation. And this is also when we start to tease out things like, is it a hearing issue? Is it something else that's going on? That's why it's really important to get a baseline, because it may not just be memory or executive functioning. It could be hearing. It could be some other kind of sensory. So I think looking out for things that definitely appear to be different compared to how they were a year ago or sort of historically what you've known.
Okay, so that makes me think about, and by the way, you're hearing the voice of Dr. Nicole Fowler. She is everything wonderful. So it makes me think about the importance of primary care and going to your doctor. One, letting your primary care doctor know you as a patient so they can see any of those changes. But I don't know that they always do a really good job of teasing those things out.
Yeah. Well, I think sometimes, the first thing to know is that most of us will never have an opportunity to see a specialist. It's really one of the things I think a lot about, because most of my work happens in the primary care setting or home and community-based setting. We're here and we're lucky in Indianapolis. We've got access to great specialists in neurology and geriatrics and palliative care. But if you live in a place where you don't have that, your primary care provider is your doctor.
That is a great point.
Yeah.
I mean, that's a great point. I have a slew of specialists with my health issues in the past. And I cannot, when you said that, I was thinking, what? Like, I can't imagine, but you're right. It depends on where you are.
Yeah. And, so a lot of times when we talk about, who is the appropriate person for you to bring up this kind of issue with, primary care is the perfect place to start. One is because oftentimes, they have a longitudinal relationship with you, or they want to, right? It's somebody that you see more than just once for an acute issue. It's somebody that you see maybe once a year, maybe once every 6 months. And so I think they're the best person to kind of bring that up if you have concerns, whether you're a family member or whether you're a patient. And I think there's a lot more primary care providers now who are actually recognizing that it's something they should be asking about.
Well, which is great because we don't have enough geriatricians.
That's right.
I mean, so, thank goodness that is what you're saying and what I'm hearing. And okay, so are there anything that caregivers or individuals can do at home to kind of test? I mean, I know there's the whole, remember these 3 words and ask someone again in a few minutes. Is there anything they can be doing, or should they just leave that to the professionals?
Yeah. Well, I think first of all, I would never sort of advise an adult daughter to try to, pull out a neuropsychological exam and do it on a parent, because I'm sure that won't make for a really nice, fun Sunday dinner. But what you could do is you could ask your parent, do you notice anything? Do you notice anything that's changing? Do you have any concerns about your memory or thinking? Do you think maybe, my brother, do you think Tom, do you think he would actually have any,
It's funny you say that. And
concerns?
I'm like, how many of us don't do that?
Right.
Just don't have the conversation.
It's oftentimes just kind of asking, I think, too, and not in a way that feels, of course, threatening, but just in a way that's sort of, do they have any concerns? Because I think sometimes, most of us may have a concern, but until we get asked about it, we won't bring it up. And so just by opening up the door and saying, do you have any concerns? I was listening to Caregiver Crossing, or I was watching the NBC News, and I just was curious, do you ever have any concerns about your memory? Just starting the conversation, and then maybe inviting them to talk with a provider and asking if you can go along.
I love it. Name it, have the conversation. You don't have to pressure, right? And asking to go along, I think, is critical too. It's hard when we send someone to a medical professional by themselves, particularly to talk about something that might be dementia related. So I know we're going to take a break. Dr. Nicole Fowler is going to stick around with us, and don't go anywhere. We'll be back in just a moment on Caregiver Crossing.
You're listening to Caregiver Crossing, a show designed for family caregivers and the people who love them. Caregiver Crossing is brought to you by Joyce House in partnership with Cardon & Associates. With 20 communities owned, operated, or managed in the Midwest and more than 40 years of senior living experience, Cardon & Associates provides residents with the best senior living options and personalized service. Visit cardon.us for more information and to find a community near you. Stay put, we'll be right back with more Caregiver Crossing after the break.
T-Mobile 5G internet keeps getting better. Boost your connection to harder-to-reach places with Home Internet Plus and get internet right where you want it.
With Wi-Fi that reaches the attic, I finally have a home office.
Get a free upgrade to T-Mobile Home Internet Plus while supplies last. Home Internet Plus starts at $50 a month with autopay and any voice line. Check availability at T-Mobile.com/home-internet.
During congestion, customers on this plan may notice speeds lower than other customers and further reduction if using greater than 1.2 terabytes per month due to data prioritization. After $20 bill credit plus $5 per month without autopay. Debit bank account required. Regulatory fees included for qualifying accounts. $35 connection charge applies.
You know that feeling when your favorite brand really gets you? Deliver that feeling to your customers every time. Memorable moments like these are key to building your business and your brand. Klaviyo turns your customer data into real-time connections across AI-powered email, SMS, and more, making every moment count so you can continue to build smarter, more meaningful relationships with your customers. Build smarter digital relationships with your customers and make every moment count with Klaviyo. Learn more at klaviyo.com/BFCM.
We're back on Caregiver Crossing, and I'm your host, Tina McIntosh, here with our producer and co-host, Noah Taylor. Hey, Noah.
Hey, how's it going?
I swear he's sitting here, even though I love Nicole Fowler, Dr. Nicole Fowler, and she is still here. And we've been talking about caregiving, a lot of the work that she does as Director of Research for the Division of Internal Medicine and Geriatrics. And then there is something really big coming that's called the guide model. And we need your help to understand it.
Sure.
You feel equipped? Are you ready?
I'm ready.
So in very simple terms, like I'm second grade and I want to understand what this guide model is that I keep hearing about. It has something to do with Medicare.
That's correct.
What does that mean?
So let me start because I'm sure your audience is well aware if they're caring for somebody, a family member or friend who has dementia, oftentimes what they need is not what Medicare provides. And many people have been talking to Medicare over the past 20 years about the fact that there's a lot of people living with Alzheimer's disease and another form of dementia, may even be from Parkinson's disease or some other neurodegeneration, and they're not getting what they need. They need caregiver education and support. They need care management to help them make connections between their specialist and their PCP. They need information about how to get things like Joy's House and Area Agency on Aging, home and community-based services, and that's really hard for them to get. And so over the past 20 years, there's been lots of data that providing these types of services to people living with dementia and their family members really does improve outcomes. It improves patients' ability to stay at home longer, behavioral and psychological symptoms, meaning that they're not as, agitated, family caregivers feel they have support and are less stressed. And these are the kinds of things that aren't frequently paid for. There are places across the country that have been doing this either through research money or through philanthropy, but it's not accessible to everybody. And
not maybe the best model to sustain going forward.
That's correct. Yeah. And so there was a lot of discussion with Medicare back in late 2019, early 2020, when something was ready to get started. And if you may imagine, something else happened that derailed a lot of the healthcare plans that the federal government had. So COVID really delayed the ability for Medicare to take a look at all of the evidence that's been generated over the past 20 years. Some of it right here in Indiana, and other places like our partners in San Francisco or UCLA or Johns Hopkins have also been developing this evidence base. And so finally, in late 2023, or it's actually summer of 2023, I think Medicare announced the fact that they were now going to be offering providers, so mainly these are health systems that deliver care to people. They could either be a physician's practice or a health system, that they were going to allow them to apply to Medicare and describe the type of program that they would put together based on the data that's been presented by us folks in Indiana and other places about how best to care for people, maybe with their own spin. Maybe they, care for a lot of people, who speak
they like
Spanish.
Innovation. I mean, even with the evidence-based, they like the innovation.
Yeah. Well, and they recognize they wanted to be, culturally appropriate and tailored to the community. So people were allowed to submit applications to say, hey, we have a program. Here's what our program looks like. Are you willing to accept us as a participant? Or we think we can put together a program. Here's what we think we would do. Would you accept this? So all of those applications were due in January. And in April of this year, of 2024, places across the country were notified if they were asked to participate. So we are lucky enough to have 3 participating here in the state of Indiana. So Eskenazi Health will start in July of 2024. IU Health will start in July of 2025, as will Aging and In-Home Services of Northeast Indiana and Fort Wayne will also start in July of 2025. And this is a great opportunity. This is open to every Medicare beneficiary who has Medicare fee-for-service. So unfortunately, if you're enrolled in a Medicare Advantage plan, this wouldn't be an option for you, but this would be Medicare fee-for-service who are living in the community, have not decided to opt for PACE or hospice, and they can actually find a provider who is delivering this service, and they don't even need to change their own doctor. So, for example, you just heard me say IU Health, but if you get your primary care from St. Vincent, that's fine. You can continue to get your primary care from St. Vincent, but align with the IU Health Guide program. It doesn't allow people to make choices or restrict to what they've already been giving. It's
which
an
is really
enhanced
key
service
for people as they're aging,
Yes.
and particularly living with dementia,
Absolutely.
right? History, trust, all of the things. And then if I'm participating in this, so I meet the qualifications and I'm participating in the guide program, what do I get? What's the benefit? Let's say that my husband has dementia and I'm his caregiver. What's the benefit to my family?
Yeah. So I will say that it's specifically designed both for the beneficiary and for their caregiver.
Brilliant.
And their caregiver does not have to be a Medicare beneficiary. So the other thing that makes us really innovative is in the past, Medicare's really just focused on the beneficiary. And in this case, they recognize that there's lots of people who provide care who are not Medicare beneficiaries. And so what you would get is a special care navigation service. And in the guide model, they're calling them dementia care navigators. And that dementia care navigator would be somebody who checks in on you on a frequent basis, may do a home visit, find out some of the things that you in particular need, some of the things that maybe you want to learn more about, and put together a care plan with other people on the team. So the other people on the team, of course, include the family, but they also include maybe nurses or social workers and, of course, physicians who will serve as the medical director for the program. And then they help coordinate that care. So if you say, you know what, I really think I need 2 days a week where I can go and do my shopping and, spend some time to myself. I need 2 days of respite care. Then the guide model would figure out what are some of the resources in your area for you to be able to get those 2 days of respite care.
This sounds like the best of every world. I don't have to change our providers, and I'm basically getting a person who is my contact who will act as a social worker, a connector, a medical listening ear, like all these things, and help me with things I don't even know that I necessarily need.
That's right.
Okay, so here's the deal, Noah. I know we have to take a break here in just a minute. I'm going to ask you to stick around just for a couple minutes into our end of the hour here.
Sure.
So just stay with us. But all right. Now, I know that people are going to start, if anybody's enrolled in Medicare fee-for-service, they're going to start getting notifications in the mail,
That's
right?
correct. Oh, and it's really important because I know I oftentimes go to my mailbox and take a look at things that look like form letters and throw them out. But if you are a Medicare beneficiary who's living with Alzheimer's disease or dementia, or you're caring for somebody, be on the lookout. Because if you live in Indiana and one of the service areas, especially Marion County and the areas around IU Health hospitals or in the Fort Wayne area, you will likely be getting a letter, from Medicare that says, hey, there is a participating guide program in your area that you may be eligible for.
Okay, so, and that's hard because we're always on this show talking to people too about looking out for scams and, all of that.
Yes.
So no, this would be with the Medicare fee-for-service. It would talk about the guide model. If you have questions about it, then you need to reach out to that provider, right?
That is correct.
And confirm that this is indeed something. Don't just go sign up for something
Don't just go
online.
sign up for anything, and do not give any personal health information over the phone, because these
Yes.
programs know exactly what they should be asking you, and that information would not be scammable.
All right, we have to take a break. We'll be back here in just a moment.
You're listening to Caregiver Crossing, a show designed for family caregivers and the people who love them. Caregiver Crossing is brought to you weekly by Joyce House in partnership with Cardone & Associates. We are here every week to bring you support, education, and hopefully a good laugh. Visit caregivercrossingradio.org to connect with us, hear past episodes, learn more about caregiver support resources in the community, and much more. That website again is caregivercrossingradio.org. Please don't go anywhere, and we'll be right back with more.
Bombas makes the most comfortable socks, underwear, and T-shirts.
Warning, Bombas are so absurdly comfortable you may throw out all your other clothes.
Sorry, do we legally have to say that?
No, this is just how I talk, and I really love my Bombas.
They do feel that good. And they do good, too. One item purchased equals one item donated.
To feel good and do good, go to bombas.com/Wondery and use code Wondery for 20% off your first purchase. That's BOMBAS.com/Wondery and use code Wondery at checkout.
Are you struggling to close deals? Cold outreach is wasting the time of both the buyer and seller at every stage, especially when sellers are using shallow and outdated data. Your organization can overcome these challenges with technology that translates comprehensive, high-quality buyer data into real-time insights. These deeper insights empower sales reps and teams to adopt the habits of top performers, which leads to better outcomes, like more pipeline, higher win rates, and larger deals. We call this deep sales. And we've built the first deep sales platform with the next generation of LinkedIn Sales Navigator. Right now, you can try LinkedIn Sales Navigator and get a 60-day free trial at linkedin.com/trial. That's linkedin.com/trial for a 60-day free trial. Let LinkedIn Sales Navigator help you sell like a superstar today. Just go to linkedin.com/trial and get started.
Good morning, good afternoon, and good evening. Hello, everybody. Thank you so much for sticking around with us on Caregiver Crossing. If this is your first time joining us, Caregiver Crossing is a show brought to you by Joy's House, presented in partnership with Cardon and Associates. We're right here every week to discuss all things caregiving. Today, we've got some really important information today provided by the Prime Life Enrichment Center in partnership with Indiana University Health. Today, we have some information about navigating vaccines as an adult. Now, these are an essential pillar of health maintenance as we age. For individuals aged 55 and older, staying up to date with vaccinations can significantly fortify overall well-being. Now, it's understandable that many people are nervous and hesitate to introduce vaccines into their bodies. Two common concerns are safety and vaccine efficiency, or how effective it will be. Most vaccine side effects are quite mild and could include things such as arm pain or a fever. Severe or persisting side effects are quite rare. According to the Centers for Disease Control and Prevention, CDC, the Food and Drug Administration, FDA, constantly monitors vaccine side effects. No vaccine can fully protect you from a disease all the time. This is especially true for vaccines focusing on viruses that change often, such as the influenza or flu and COVID-19. Even if you do experience infection, the vaccine will lower the severity of the sickness. So we're going to talk about knowing which vaccines are recommended and when your doctor would recommend one of these. So there are several vaccines recommended for adults. They do include the influenza, the flu vaccine. So annual flu shots are highly recommended for adults and really anybody who can come into contact with the flu. People over 65 years of age should receive a higher dose flu vaccine. COVID-19 vaccine. For individuals aged 55 and above, getting vaccinated against COVID-19 remains a critical step in safeguarding against severe illness, hospitalization, and complications associated with the virus of COVID-19. So next up, we have the tetanus vaccine. A one-time Tdap vaccine booster is suggested for adults who haven't received it previously, followed by a tetanus or Tdap booster every 10 years. Now, this vaccine guards against tetanus and whooping cough. We have measles, mumps, and rubella vaccines. All adults born after 1957 without a previous vaccine or laboratory evidence of immunity or disease should be vaccinated with MMR. This is a live vaccine and should not be given if a person is immunocompromised. Next up, we have the varicella or chickenpox vaccine. Adults with no evidence of immunity to this virus, to varicella, should get this vaccine. Next up, we have the shingles vaccine. Shingles can be caused by the varicella zoster virus. Chickenpox can cause a painful rash and long-term nerve pain, especially in older adults. The shingles vaccine, available as Shingrix, is recommended for individuals aged 50 and older. Pneumococcal vaccine. Pneumococcal disease can lead to pneumonia, meningitis, and even bloodstream infections, posing heightened risks for older individuals. The CDC recommends 2 pneumococcal vaccines for those individuals over 65 years old. Respiratory syncytial virus, RSV vaccines. Adults 60 years and older are recommended to receive a single dose of the RSV vaccine if their healthcare provider thinks it would be better. Lastly, the last vaccine we have for you here today are hepatitis vaccines. Multiple 2, 3, and 4 dose vaccine series are available for hepatitis A and B. Adults under 60 are recommended to get one of the series of hepatitis B vaccines. Adults older than 60 with certain risk factors should receive a hepatitis B vaccine. All other adults 60 and older may receive the series. Hepatitis A vaccines are not routinely recommended for most adults. It is important to consider your individual health status, allergies, and potential interactions with existing medications. Ask your primary care provider or pharmacist which vaccinations make the most sense for your specific health needs. To find a provider near you, visit iuhealth.org/primarycare. As we close out the show today, we'd just like to remind our listeners that they can contact us for more information and for resources to help you through the journey of caregiving at 317-254-0828. Again, that phone number is 317-254-0828. Please don't hesitate to reach out to us if you need any advice or resources about your caregiving journey. Caregiver Crossing is supported by Cardon & Associates with 20 communities owned, operated, or managed in the Midwest and more than 40 years of senior living experience. Cardon & Associates provides residents with the best senior living options and personalized service. Until next time, take good care of each other. And happy Halloween!